Good evening. Thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. Throughout the pandemic, Mary Washington Healthcare leadership has been committed to keeping our community informed. We know you have a lot of questions, and tonight we're here to share with you what's happening in our region with COVID-19 and what you can do to stay safe and healthy. During this town hall, you will hear from our expert panelists, and we welcome you to ask questions in the chat during the conversation. So let's meet our panelists. Tonight, we have Dr. Mike McDermott, Chief Executive Officer, Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer, Eileen Doman, Chief Nursing Officer. Thank you all for joining me this evening. Dr. McDermott, I'd like to turn it over to you to start the program and tell our viewers the latest information regarding our region.
Thank you, Lisa, and good evening, everybody. Thanks for taking a few minutes out of your evening to tune in to our town hall, and so we can bring you up to speed with what's happening here in the Fredericksburg region with this Omicron surge of COVID-19. It's been quite a week since we've spoken to you last. We wanted to bring you up to speed with everything that's happening here. I'm going to start with some of the graphics we've been sharing throughout the pandemic, spend a little bit of time on this one. Currently, we have 186 patients who are currently hospitalized between Mary Washington Hospital and Stafford Hospital that we are treating for COVID-19. And I want to be very specific about that. There's been some controversy out there talking about people being hospitalized with COVID-19, but not really. They're here for something else. We're here at Mary Washington Healthcare, and really every hospital in the state of Virginia has been pretty good throughout the entire pandemic, where we are reporting patients who are hospitalized for COVID-19 as their diagnosis. They're here because they require hospitalized care for COVID-19. That is their diagnosis of while they're here. I want to just spend a little bit of time on the graph and go all the way back to the left, the beginning of the pandemic. On the right side is where we are today, but that left side, remember back when this pandemic started in the spring of 2020, we were bracing and having town halls with everybody here. The yellow line, that's the number of patients we had as inpatients on any given one of those days. And you can see, even in that early spring of the pandemic, when we were bracing, the most inpatients we had really at any point in time in the early part of that pandemic, 30 inpatients between Mary Washington and Stafford Hospital. Then you get to January of last year, a year ago today, when we really had our peak demand. And you can see that yellow line goes up to 100 inpatients that we had really just at about this point last January. We peaked at 100 inpatients. It rapidly dropped and we had another surge in the spring, but I want to take you to July of 2021 on that graph, where you can see there was a 6-hour period in the summer, June 28th, where we had no inpatients hospitalized at Mary Washington Hospital or Stafford Hospital for COVID-19. And at that point in time, most of the community was getting vaccinated. We were feeling pretty good, but the Delta variant, the mutation started to happen. That Delta variant came out and it really, you can see what it did to us in the fall, where we got back up to about 76 inpatients. We started to recover from that here coming into the holiday season, but really from Christmas until now, look at the slope of that graph. And so we have roared past our high of last winter, where we had about 100 inpatients. 2 days ago, we were at 197 inpatients between Mary Washington Hospital and Stafford Hospital. Currently, we're at 186. Really just unprecedented care demands placed on our system from the number of patients in our community that require hospitalized care for COVID-19. The next graphic we like to share, we're able to look at the inpatients who are under our care, and we know their vaccination status. We know in the state of Virginia, actually for adults 18 and older, about 80% of Virginians 18 and older are fully vaccinated, right? And that's good news. So if COVID was prevalent equally throughout our community, we would expect 80% of our inpatients to be at least blue, and that's not the case. More of the figures on this graph are the yellow color for not vaccinated. It's taking a larger toll on the unvaccinated. There are some breakthrough infections amongst the vaccinated population. It's why it's important to get a booster. If you're more than 5 months out from your initial vaccination, you need to receive a booster. It's very, very helpful. And many of our vaccinated patients that are blue in this figure, were eligible to receive their booster. They were more than 5 months out. And then there are very few boosted individuals, some of those immunocompromised individuals that are not able to mount a response to the vaccines, who also are requiring hospitalized care at this point in time. I want to talk about the burden that we're seeing in our intensive care unit. We have 38 licensed ICU beds at Mary Washington Hospital, 6 licensed ICU beds at Stafford Hospital. They are typically usually filled with the routine emergencies, medical emergencies that happen in our community, the heart attacks, the sepsis cases, the patients that have an aortic dissection, something that requires hospitalization in the intensive care unit. Right now, we have over 33 ICU patients that are in our ICU because of COVID-19, and over 20 of those on ventilators. That's double the amount of patients on ventilators that we've had at any point in time in the pandemic. And it is putting an extraordinary burden on our health system. Many of you may have heard that recently we have made a declaration that we have moved to crisis standards of care. And I have a small graphic I'd like to bring up to just explain to the community what exactly that means. And so in the state crisis standards of care guidelines, there are 3 levels of care that are discussed. The typical level of care when you're not in a pandemic and things are normal is conventional standard of care. It's when you have usual patient care spaces, all of your facilities available, usual staffing, and you are doing kind of conventional care. The second level is a contingency level of care. It's when you might need to make some modifications to your facility or to your staffing to make it functionally equivalent to the conventional standard. Most of the pandemic, we have spent our time in the contingency level of care. We're making modifications with staffing or where we are providing care, but we feel like we are able to provide functionally equivalent care with those modifications to the conventional level of care. Another important point there is that in contingency standards, oftentimes there's the ability to transfer patients to other care sites in the state that require higher levels of care. And that transfer between facilities is a very important factor in the overall capacity of healthcare in the state of Virginia. We have moved to crisis standards of care, a higher level where you are actually saying you may not be able at all times to be functionally equivalent to conventional levels of care. We are using care sites within our hospital that are not typical. We are already having the toughest time with staffing that we've had in all 2 years of the pandemic. And then the volume of patients is extraordinary. It's doubled what we've seen at any other times of the pandemic. And then also, most importantly, we have lost that ability to transfer patients from facility to facility within the state because every single health district in the state of Virginia is surging simultaneously. That also has never happened during this pandemic. The northern region might have surged while another region of the state was not in surge. But currently, every single health district in the Commonwealth of Virginia is surging simultaneously with this Omicron variant, and nobody is able to accept patient transfers from one another. The patient transfer situation has just shut down throughout the state. That's why ourselves at Mary Washington Healthcare, Bon Secours health system, I think Valley Health is just about to announce, and other health systems are announcing that they are recognizing that they are in crisis standards of care. And it's one of the things I wanted our community to learn a little bit more about tonight.
Thank you, Dr. McDermott. I imagine this is sobering news for many of our viewers. We've been living this for the past couple of weeks and responding to the needs of our community, but crisis level of care, now that we understand what it means, how has Mary Washington Healthcare responded to that? Eileen, can you help us understand what's happening at our hospitals right now?
There's a lot of things that are different that we've had no choice but to do some things differently because of the sheer volume of COVID patients. So for example, at Stafford, there's more units where we have COVID patients that are being hospitalized. At Mary Washington, when we've talked about units, we've had dedicated COVID units. There's now more of them. So staff that may not have been working on a COVID unit now are, because their unit has become a COVID unit. Our ICU, Mike mentioned that 38 beds at Mary Washington, 6 beds at Stafford. We're talking about physical capacity. There are no more ICU rooms at either of those two hospitals, but yet there have been more ICU patients. There was a day that we had about 46 ICU patients just at Mary Washington. So what we've had to do is go into another area of the hospital that we could convert rooms or convert areas so that we could use them as an extension of the ICU. That's not typical. That's definitely part of crisis. Then when we think about staff, you know, we've been telling you that this is the most difficult time we've had as far as having staffing available in our hospitals. And yet we have had to do something. We've had no choice in these past 2 weeks. So we're really redeploying staff from all across the organization. So within our hospitals, nurses are being moved from one unit to another to help. We've got nurses that may be part of our Mary Washington medical group and our physician practices that have been tapped to come to the hospital to help us take care of patients. Doesn't mean that the practices aren't busy. It's just that we're asking every part of the organization to really look at what they absolutely have to do and how we can free up staff to help us. So we've been redeploying and moving our own staff around the whole organization. You know, we've been very fortunate up until now that some of our own staff have volunteered, have said, hey, I'm a nurse. I work in an area that I'm not working as a bedside nurse. I'd like to help. And we've had some of those volunteers. Now that's really changed. We're tapping into all of those people and saying, we need you to help us. So for departments identifying who are the people that can be redeployed to get to the hospitals to help us take care of patients. We've changed visitation again, you know, and you've heard us multiple times talk about, you know, that visitation is an important part of a patient's recovery. But we can't have additional people. We have to limit. We really have to hunker down and protect our facilities and the people that are in them from the potential of exposure. So now we're back to limiting to one designated visitor for a hospital stay. Nobody likes that. That's hard for patients. That's hard for loved ones. That's hard for us to manage. But we have to take these steps because this is a crisis. This is not anything close to the way we usually operate. So we've made changes just because of physical capacity. How do we make more areas where we can care for patients? You've heard us talk about our field hospital. We built the field hospital 2 years ago, and as proud as we have been of the field hospital and the innovation in creating it, I think I would be fair to say that all of us deep inside said, I hope we never have to use it. Well, we're using it, it's open. And we had no other choice because we needed to create space and capacity within our emergency departments because they were so full. So just whether it's physical space so we can take care of patients, it's having the staff that we can take care of patients, and then limiting the number of people that are in our buildings. It's, you know, in my nursing career, never would I have imagined the things that we've been doing, you know, in these past couple of weeks to make sure that we can keep our staff safe because we need them to take care of all of our patients. But then also making sure that we can take care of our community and be here for our community.
Thank you, Eileen. It's so much happening at the hospital so rapidly that I imagine our community can't really keep up. And one of those things that we did see was some shifts in our emergency department. We talked about opening the field hospital, but prior to getting that open this week, we saw a lot of EMS and first responders also sharing on social media that there was a lot of people calling for ambulances, a lot of people going to the emergency room. And really, it's might have confused some of our viewers about when to seek care, and can they seek care in our emergency room? Will they experience the long waits now that we have the field hospital open? Dr. Newman, can we talk a little bit about how some of our patients might know when is the right time to come to the hospital versus seeking care in an alternate experience, like with a physician or an urgent care?
Yeah, so the whole point of the field hospital, one of the main points was to provide expanded ability to care for COVID patients coming in through our emergency departments. So people who are triaged through our standard emergency department who are at more mild to moderate symptoms. Many of them are in more, I would say, the moderate category, meaning they're probably not acutely decompensating to the point where they're going to need to go up to the hospital. They are sent over and cared for in the field hospital. And there are limited treatments because of the scarcity of the drugs, but there are treatments that we can provide, particularly patients with high-risk medical conditions or those over the age of 65, to prevent them from worsening in their course of their COVID illness and ending up in our hospital or our ICU. So that was one of the big components of opening up the field hospital, was to improve the efficiency, provide a space where we could care for those patients such that they weren't waiting 18 to 24 hours, as was previously happening as our EDs were overrun. So a couple of the drugs, we have a monoclonal antibody called sotrovimab. It's in very limited supply, but for those who are very high risk, particularly cancer patients, those on immunosuppressant drugs, and other kind of conditions, high concerning conditions, we can give that medication to. Others who might not qualify risk-wise for that drug can receive a drug called remdesivir, which we've been talking about for quite a while here. We continue to use remdesivir in the hospital, and but I think once people get that sick, the efficiency and the efficacy of that drug is minimal. But what some studies have shown, if we catch it a little earlier in some of these high-risk patients and give them that IV drug earlier, we can prevent hospitalization. So we are providing those infusions, a single dose, and then patients come back to one of our infusion chairs in the field hospital for 2 more days and perhaps have a better outcome. So previously, we were telling patients, don't come to the hospital unless you're very, very ill. Now we're telling patients, if you've got a significant risk factor, and I would say things like significant heart disease, obesity, diabetes, respiratory conditions, severe asthma, emphysema, some of those kind of conditions, cancer, or if you're over the age of 65 and you get a positive test and you start not feeling well, those are the patients that we can treat and perhaps prevent going on from having a worse outcome and have to be hospitalized. Our field hospital then looks at patients. I saw there was a question of what are we doing for our patients in the hospital that couldn't be done at home? And we have set up a safe at home program. There is a subset of patients that we were hospitalizing that would get IV remdesivir, and they maybe get IV steroids, and they would also get oxygen. We would watch them for several days, and some patients get better and get to go home, or some patients worsen, and then we have to take care of them. So there is a subset of patients where we can enter into this safe at home program through our field hospital, and we can even do oxygen at home. So we're setting patients up with oxygen at home. We're giving them the medications, the IV remdesivir. Some of them will get the steroids, go home. We're having nurses call them daily. We're having their oxygen levels monitored, and we're calling them, and we're also having some of our hospitalists, medical doctors, do a few telehealth visits while they're at home. And if their condition does happen to worsen, we can then bring them in. But otherwise, they're able to be cared for in their home and monitored safe at home. So that's an important piece. All these patients in the hospital, the 180 some patients, those that are not in the ICU, what are we doing for them that can't be done at home? Well, one of the big things is high flow oxygen. That can't be provided at home. Some of these patients, their oxygen levels are so low that regular oxygen can't bring them up to a safe level. And they're right on the edge of really, truly needing to go onto a ventilator or some higher level to help them breathe. Other patients are receiving a respirator device called BiPAP that's kind of one step below a ventilator and helping them breathe. And then there's many things that happen to patients, from renal failure. It puts a lot of stress on the body when people start having advanced COVID symptoms. So there's a lot of supportive care in some patients that's required. And those are the patients who are in our hospital.
Thank you. And we're getting a few clarifying questions about the field hospital coming in while you were speaking, and specifically around how are we managing to staff this? We've already said that we're struggling with staff. Our ER's already struggled with staffing, as we know, with the volumes coming in. How are we staffing it, and how is this impacting our other 2 emergency rooms in Mary Washington Healthcare?
Yeah, this is one of the parts of crisis standards of care. We do not have the conventional staff to care for individuals. So we are pulling, it's all hands on deck situation at this point. We have people coming from the medical group. We're deploying people from other areas in the organization. This is some of when we talk about we have to not do as many surgeries or scheduled surgeries. Some of the staff from the operating rooms and the cath labs and some of those areas are having to be redeployed to other areas in our healthcare system. So it is very tight. I would say, so many of our associates are working so far overtime. They're working 5, 6, 7 days a week, long hours to really piece it together to care for people. And we are stretched thin. So we do not have extra staff. I think last week we said we wouldn't be opening the field hospital because we didn't have the staff, but we were sort of forced. Between last week and now, so many more patients coming in, so many more patients needing care, and we're having to be very creative in how we're able to stand in and care for our community.
And patients don't go directly to the field hospital. They come through the ER, and then if they meet the appropriate protocol criteria, they are moved into the field hospital with the staff that we have mobilized in the field hospital. And the field hospital is conditioned and does have heat and other sorts of things in the field hospital. So it is a conditioned space.
Yes.
A lot of questions about scheduled surgeries. Some people call them elective surgeries. We don't like to use the term elective surgeries because all those patients have care needs that need to be met to have better health outcomes for themselves. Somebody in one of the questions even used an example, somebody with prostate cancer that needs to have their prostate removed. That is a scheduled surgery they need to have to get a better health outcome. And with this current demand, we have had to throttle that. We look at it every single day. The team looks at what we're able to accommodate, but we're not doing the typical amount that we do on any given day. So some of those have been affected. Some of the scheduled procedures have had to be delayed, but we're trying to meet as much of the care demand for our Fredericksburg region as we can on any given day. And the team is meeting, we're in incident command mode where they're meeting multiple times a day to look at what is it we're actually able to do at any moment in time on any given day to meet those care needs of our community.
We just had a question come in. Dr. Newman, you were speaking around monoclonal antibody treatments and other infusion therapies. If someone tests positive, do they just show up to the ER to get that service? How does that work?
No, I mean, that is not the ideal. Although if you are at a high-risk patient and you come in through our ER, you can be redirected to the field hospital to receive appropriate treatment. I will say, just to give people an idea of how many doses we have, we got 18 doses of monoclonal antibody this week. So it is really in short supply. Previously, we were giving over 20 doses a day, and the demand is far higher at this point. So we are having to look at who gets what, but we do have the IV remdesivir, we do have steroids and others. So HealthLink is an area to call to find out how some of this can be coordinated. The field hospital coming in through our ED, if you are a cancer patient and test positive and you can't get this coordinated, that is an option. We are strongly stressing this is not a testing site. If you have some mild symptoms, you're a younger, healthy person, please don't come to the ER for a test. But if you are a higher risk, if you're over the age of 65 or you have significant medical problems, that would be okay for you to come and be redirected to the field hospital.
And
one of the questions that I see here is talking about we're hearing a lot about get vaccinated, right, and get boosted, and those are important, but not hearing as much with this current Omicron surge talking about people wearing a mask or social distancing. Are those still important? They are very critically important at this point in time, and I wish there was more messaging talking about your activity level, social distancing, the number of interactions you have with other individuals. And it's like many of the other surges have been like rising tides, right? They happen slowly. This Omicron surge is a flash flood, right? It is here all of a sudden, flash flood, overwhelming. And so when you're in a flash flood, don't go into the flood waters, right? I think that's just safe and logical. Don't go into the flood waters. And if you do have to be near that water, the highest quality mask that you can wear with the best fit around your face is what is most important: filtration and fit. And so the highest quality mask, a surgical type mask that has the better filtration, a KN95 or an N95, I consider those functionally equivalent. The N95s are typically medical devices. The KN95s, if it's sourced from a reputable source and a good fit around your face, that is an absolute great mask to be wearing. And then limit your interactions around others, right? Taking a mask off and eating in a restaurant right now, consider yourself exposed to the air and the aerosolized air of everybody else in that environment. I think that's just the case. And when you look at some of the, currently people are talking about the prevalence, how much coronavirus, this Omicron strain, is out there in our environment. And when people look at the number of tests that are reported, the PCR tests that get reported to the state, but so much of the testing now is the at-home testing with the antigen tests that are not reported to the state, right? And then on top of that, people who have symptoms know they were exposed to somebody who has tested positive, but can't find one of those tests and never get tested. And when the estimates are going, you're talking about possibly 1 out of every 10 individuals in our community right now, 1 out of 9 or 1 out of 10 individuals are likely infected with the Omicron strain. That is extraordinary. We've never seen that level of prevalence in our community as we can at this point in time. So getting vaccinated and boosted, very important to protect yourself if and when you come down with the Omicron variant, but also wearing a high quality mask, limiting your interactions, also very important at this point in time to avoid contracting the Omicron variant in this flash flood scenario that we're in. We're near the breaking point. I think you can hear that from us today. Like, we are reaching the breaking point. And so the things that people can do to help us is, we talked about, get vaccinated. If you've been vaccinated and you're eligible for a booster, get your booster, right? And then wear a mask and limit your interactions. Those are the things everybody listening tonight can do to help us, because our health system is near the breaking point, has passed the breaking point in some areas currently. And that's what we're here to talk to the community about tonight.
I think we're feeling that a little from the questions coming in. There seems to be a lot of love and support for our staff and worry for their safety as well. What are we doing to keep our staff safe? And Eileen, I'd like to pose that to you. And also, have we reached out to recently retired nurses or other staff that might be licensed professionals that might be able to come in and help out?
Yes. So we were very fortunate when we did the vaccine clinic that we had some great volunteers from our community that helped us during the vaccine clinic. And so we're reaching back out to many of them to ask them to help us now and to be able to be at the side of our staff, helping our staff that have been here through all of COVID. You know, I wish I could say that we're hiring a whole bunch of nurses and it's going to be great. They're not out there. And so while we may not be able to add a number of nurses, if there's volunteers from our community that we've worked with, we certainly are tapping into them. But even as I mentioned earlier, is looking at our own workforce across Mary Washington Healthcare is, if I can't say to a nurse, I have another nurse that can come to help you, but I can say, but I have somebody who could help you with turning and positioning patients, or I have someone that can help you as far as helping to take out the trash in a patient room, or to be at the front desk to answer phones. Those are all things that also help a nurse that's at the bedside to be able to have more of that time at the bedside with our patients. Our staff are tired, but on the other hand, they're tired less. They have been here through all of this. Each time, you know, every day it feels like there's some new challenge that we're facing, and you think, oh my gosh, how can we do this? And they come through and help us figure that out. So, you know, I'd love to be able to say to them, take a day off tomorrow, you know, don't come to work, take care of yourself. They're trying to do that as well as they can. But what we're trying to do is just look across our workforce, the volunteers that have worked with us, to say, how can they be brought to bear to help our clinical staff that are at the bedside.
Yeah, I'm so proud of the resilience, the creative problem solving of our staff. This has been a long, difficult 2 years. And like I said, people are working extra shifts, overtime, and really standing in for the community. We are losing staff to burnout. I mean, there is no question across the nation that is occurring. And right now we're losing staff to COVID. It is so prevalent in our community. We are losing some of our physicians and bedside nurses and other associates to COVID. So it is just so extraordinarily hard for our associates every day to face what we're facing. A lot of the some questions about how we're keeping people safe in the care areas, particularly, we're bringing people in from the medical group and other areas that may be not as in tune to hospital infection control practices and safety. So we are what's called fit testing with N95 masks. These are sealed kind of masks for the healthcare providers, and we're giving them some education on that to make sure we can keep everybody safe when they're in our facilities. And in fact, we're having heightened awareness about that right now, about importance of high quality masking, even in the hospital, not letting your guard down even for a few minutes to take a sip of coffee or a drink. Do that outside of the healthcare unit, just to keep safe, because Omicron is so contagious.
And, we are getting some further questions about vaccination, if we could go there. We have actually one person put into our chat that they haven't gotten the vaccine because of the fear of long-term effects. And they really just need us to say, will they suffer long-term because of this vaccine?
Yeah, don't listen to rumors, right? Follow the facts. These are some of the safest vaccines that mankind has ever produced, right? With billions of doses given across the world, right? So there should be no vaccine hesitancy, right? The safest health decision you can make is to get vaccinated to protect yourself. And if you've been vaccinated and you're more than 5 months out, to receive a booster to protect yourself. That is the absolute best health decision that you can make. Scientifically, there is no doubt about that. So don't listen to the rumor mill or go down the rabbit hole on social media with people telling stories. There are people that are master storytellers that stoke fear, uncertainty, and doubt in people, right? And don't do that. Follow the facts, follow the science, get vaccinated. It's the best health decision you can make.
Our hospital and our ICU is filled with unvaccinated patients who are fighting for their lives right now. We have not had a single, that I can recall, vaccine injury patient in the last 2 years. It is a falsehood that these vaccines cause significant injuries. They are extraordinarily rare, but severe outcomes from COVID are common. We're seeing them every day. And one thing that we don't talk about, you talk about long-term effects from vaccines, upwards of 10% of people after COVID, even mild COVID symptoms, are becoming what we call long haulers and are having chronic problems that are going on months to years after their COVID diagnosis. Brain fog, loss of taste and smell, loss of exercise tolerance, shortness of breath, chronic headaches, all these kind of things that are now millions of Americans are suffering from. Don't put yourself at risk. Get vaccinated.
We've had a
lot of questions about schools, and I know that's there. And I'll just say that I know the school systems in the Department of Education in the state, they're following the science for schools, balancing the tough issues that schools have about education and all the other various issues that they have. And I have confidence that, the Department of Education at the state level and everybody is working hard through all those difficult issues, also without clear answers, to help make the best decisions that they can for the education of our children.
Thank you for addressing that, Dr. McDermott. We were getting quite a few questions about the schools that we didn't want to think anybody was ignoring them. Right now, we are so focused on what's happening at the hospitals, and I think we need to get back to some of those questions, if you don't mind. If we can go back to boosters, there's a lot of questions coming in, of varying questions about immunity. How long do things last? How safe am I? When should I get a booster? Can we talk about how long you go and how long any kind of immunity might last? There was even a question of somebody who's fully vaccinated with a booster and had COVID within the last 90 days. Yeah. What does that look like? People just don't know how to navigate that.
So we do know that the immunity is waning from the initial vaccines, and that can happen anywhere. You start seeing breakthrough infections To some extent at 3 months, but mostly after 6 months from that initial vaccine course. Hence, we are strongly recommending the boosters. The boosters at this point are relatively new. I had my booster 3 months ago. So this is not something we have long-standing history on, or we can look back and know or say with certainty, will the booster last 3 months, 6 months, or long term. Some vaccines work where you get a course and you get a booster and you really have lifelong immunity. Your immune system remembers that and takes it from there. And others, particularly with vaccine viruses that may change a little bit, like mutations, like a flu shot that we have to do annually. So it is difficult to say. I wish I could say with certainty. I know in Israel they are now moving to a fourth shot to another booster. I know isolated patients here with certain immunocompromised statuses, maybe under the direction of their physician, they are talking about getting a fourth shot or a booster, but that recommendation has not been formally approved in the United States yet, or widely spread for the general population. I expect we're going to know more soon as we get further out from these boosters and see how long the immunity lasts. And then the quality of natural immunity, the same sort of thing. We're seeing about 3 to 6 months, we're starting to see people get reinfected with the different strains, multiple reports of people who are on their third course of COVID. So not long-lasting immunity from quote unquote natural immunity. And there's no way you'd want to put yourself at risk and get reinfected with COVID over and over again for that immunity when you can get a vaccine and prevent yourself from getting sick, prevent yourself from getting long haul symptoms, prevent yourself from rolling the dice and ending up in our hospital in a bad situation.
Thank you, Dr. Newman. And, we were talking a little before we started about the numbers around the state, and the booster numbers are fairly low, if I'm not mistaken. Dr. McDermott, can you speak to where we are in vaccinations
I don't know the exact number of eligible individuals in the state who have been fully vaccinated and are eligible for a booster, who have been boosted, but it lags. It's not everybody who's eligible for a booster has not gotten a booster. And so that's why I think all of the talk about people encouraging people to get a booster, because it's that, again, I use that analogy of it's like a memory, right? Back when you got your first vaccine, we showed you a picture. It's like showing your body a picture of the virus, saying, look out for this. And then over a period of months, you can be like, well, what exactly did it look like? Did it have green spikes or red spikes? I don't remember. And so getting the booster is showing your body the picture again, saying like, this is what you need to look out for. Be on the lookout for it. It's like refreshing your body's memory to be ready to fight it. And so it's very important with Omicron. It's been shown having that booster, if you're more than 5 months out from having your initial vaccination dose, having that booster is critically important. And we know there's a lot of folks who have been fully vaccinated in Virginia who are more than 5 months out who have not received their booster. And it's why we talk about it so much. So I just encourage you, if you are fully vaccinated and are eligible and haven't gotten your booster yet, that's why it's so important to get your booster. Refresh your body's memory of what it should be on the lookout for.
And should anybody be worried about mixing and matching the boosters? That might have been the question you were going to answer, Dr. Newman. If you got a Moderna, do you need to get a Moderna, or a Pfizer? You get a Pfizer, or so forth.
No, you can mix and match at this point. In fact, it may be optimal. There have been some smaller studies that have looked at that, and for people who had Pfizer and then got the Moderna booster, had probably the highest antibody levels following that. So that's something. Boosters in children, I would just say there was a question about somebody who had a child who was vaccinated, had a breakthrough infection. I would talk to your pediatrician before pursuing a booster right after that infection in a young child. But in general, in the adult population, it is safe to get vaccinated even shortly after your COVID symptoms. As soon as they resolve, it is safe to get a vaccine. There's some specific things that you may want to talk about with pediatric patients, particularly boys.
And are we certain that Omicron is really the variant we're seeing now? I mean, is that?
Yeah, we don't phenotype test. We don't phenotype test. That's called phenotype testing to know exactly what variant is causing it. Every single patient that comes into the hospital, but the state does that on a level, in the multi-state Mid-Atlantic area as well, has done phenotype testing. And by far, all the infection that's being spread right now by far is largely Omicron. We know that at a state level from the testing results that have come in that are being phenotype tested. And so we know that's how we know it is the most prevalent strain, also the way that it's acting, right? All the people becoming infected in our area the way that they are, it's acting like the Omicron variant. And so I think the assumption is, and it's safe to make that assumption, that it is by far the people who are hospitalized right now in our hospital, the majority of those are the Omicron variant, although we do not have the capability to phenotype test every single patient, nor does I don't know of any hospital in the state of Virginia that is phenotype testing every single patient that comes into their hospital or has the capability to do that.
And with these rising cases and having so many more people in the hospital, are we seeing the death rate match and climb as fast?
Yeah, the death rate lags, right? And so many of the patients, by the time they succumb, despite all the treatment to COVID-19, that can be 3 weeks or 4 weeks after they've been hospitalized. And so with the number of acute care, intensive care level patients that we are currently caring for, we're very worried about that, obviously. But that's a future thing. I don't know the answer to that yet. That's in the future. I don't know if the death rate will be the same as it's been for the other surges. I'll keep my fingers crossed that it's not, but I don't think we know the answer to that yet. The death rate is a lagging indicator. It happens weeks after a hospitalization typically.
And how long do people tend to stay in the hospital when they have COVID and need a hospital level care?
So with Omicron, it's a bit shorter than the other strains that we've seen. So there's a lot of talk about the Omicron being less severe. So in the hospitalized patients, we're averaging about a 5-day hospitalization. Now, once you get sick enough to the ICU, all bets are off. Those hospitalizations can be very, very long, and many do unfortunately end up in death. So the people who do turn the corner to the bad way that can be a very difficult thing. But 5 days is what we're averaging. We were averaging closer to 9 to 10 with the other strains. And I just want to point out here too, masking in people who are vaccinated and boosted. So unfortunate thing about Omicron compared to other strain, you're not bulletproof. The other vaccines were so great. With the other strains, it provided great protection against even breakthrough infections. We're not seeing that as much with Omicron. So I do recommend, even if you don't have a lot of risk factors, even if you are vaccinated and boosted, please wear a high quality mask. You can protect yourself from getting COVID and more importantly, protect yourself from giving it to somebody else who may be at a higher risk than you. So this is not like the previous strains. I'll even say, personally, I felt comfortable walking around, being unmasked. Previously, I'm wearing a mask out and about now. This Omicron is highly contagious, even to the vaccinated. The vaccines and the boosters are great at protecting you from getting very sick, but you don't want to go on and get it and pass it on to somebody who's at higher risk and will end up in the hospital.
Chris, there was a question, I think, about the number of pediatric patients we're seeing that require hospitalization. There have been some stories about that nationally, about some hospitals being overrun with pediatric patients that are being hospitalized. I don't believe we're seeing that here locally, like some of those other national stories have. A lot of the children who do have severe disease, we do have a relationship with Children's National and some of the regional referral hospitals for that higher level of care.
I do know that both VCU and Children's National are seeing very high volumes of inpatients at this point. I think it's not necessarily that Omicron is more severe in children. I just think it's so contagious. So many children are getting infected that that percentage is just an absolute higher number of people. So.
Thank you. And I'd like to pivot to testing. We've had quite a few questions that we didn't get to yet. One of the first questions we had was, how soon is a second test required after testing positive with a rapid test? Do you need to go get a PCR test? Tell us a little bit about the process of testing.
Yeah, so if you have symptoms and you get a positive antigen test, you have COVID. No further testing required at that point. Testing is limited at this point, but if you had symptoms that are very significant for COVID, you get a negative antigen test, then you should proceed with a PCR to confirm. But if you have an antigen test that's positive and you have symptoms, no further testing. There is that 5-day test. Repeat the antigen test at 5 days if it's available to find out if you're sort of safe to break your isolation. But you should still wear a mask, a high quality mask for the next 5 days. But that may be the second test. But in general, you only need one test. If it's positive and you have symptoms, you don't need a retest.
Yeah, the antigen tests are good. They are good tests. And I wish they were more available. I wish they were everywhere and they are in relatively short supply, but, hopefully that gets remedied relatively quickly. But I know there's lots of questions about the antigen tests and those things, but they are good tests.
Now, we have had the question of, have we reached the top of this peak? If we could look in a crystal ball, are we starting to wane, or are we still right in the middle of it?
Day at a time here, right? We're accepting reality for what it is in the moment that we're in, right? And so that's what we're sharing with everybody here today. So I don't know what the future holds. I would have never predicted we'd have close to 200 inpatients for COVID-19 here in the middle of January 2022. I would have never made that prediction. So predictions are difficult. And so I don't know if this is the peak or not, or the flash flood. There are some indicators on the East Coast. This, everybody's calling this kind of the Mid-Atlantic I-95 corridor surge. It's kind of from Richmond up through Boston that is currently having the peak of the surge. And we're in that corridor, right? And some of the things, you see the wastewater reports coming from Boston and some of the report data coming out of New York and other things that might indicate that, hey, we could be reaching a point where it's heading in the right direction. But I don't know. We'll take it a day at a time, just take the reality for what it is, accept the reality for what it is.
Go ahead.
Oh, I just see a question about the wait times in the field hospital. So no, at this point, the field hospital is only open during the day. It is not a 24-hour operation. So I will say that, because a lot of the patients need, some may need oxygen and other things that can't be set up in the middle of the night. So if a patient comes and does need some of that, they may have to stay overnight in the hospital till the next morning, and where it can be set up. At this point, we're running that from, I believe it's from 11 a.m. till 7 p.m. At this point. To try to catch that. The wait times are not long. If you do get one of the IV infusions, they generally take about an hour, but it's a very efficient process there in the field hospital.
Some of the other questions we've had are symptoms of Omicron. Is it any different? Is there anything we should be looking for that maybe we didn't realize could have been this virus all along?
Yeah, there is a little bit of variability in symptoms, and a lot of the Omicron people are talking about more of a sore throat. Like that is a symptom that hasn't been as highly associated with the other variants as the Omicron variant, this sore throat idea, even runny nose, rhinorrhea. With a lot of the other variants, it hasn't been a major factor, but with this one, maybe a little bit more. The fever, the chills, the cough, the shortness of breath, those other symptoms can still happen with Omicron like they did with the other variants. But there have been some reports of mild differentiation in symptoms with this Omicron variant. The ones I've heard most are that sore throat and maybe the runny nose that can be a little bit seen a little bit more with the Omicron variant than some of the other variants.
And, as we're getting closer to the end of our questions here, we asked, how can we protect others when like our parents or our grandparents, or protect those under 5 who haven't been able to be vaccinated, or, how do I pick a good mask? Can we go back and repeat some of those suggestions for safety and keeping yourself well?
You protect children under the age of 5 by being vaccinated and boosted if you're eligible. All adults around your children should be vaccinated and boosted. And you also protect them by, when you go out and about, and wearing a high quality mask when you're exposed to others. Don't let your guard down, and because you could get infected and pass it on. Same thing with you have to be careful with the kids. Your kids should be vaccinated so they don't come home and bring it home to a grandparent. So anybody who can be vaccinated, please vaccinate. And then we really should be, limiting the activity for a few weeks. We're not talking, this is a long thing. I think this will be a few week huge surge. I think Mike, his analogy of saying this is a flash flood is exactly right. We are being overwhelmed with the amount of COVID in our community. And I do think that it'll recede quickly as well. We no way to predict. But I think, it's worth for the next few weeks, hunkering down, being a little more careful, and protecting those who need to be protected.
Thank you. And I think we're really reaching down to the bottom of our questions here. Some of these are ones we've answered earlier in our presentation. So I'd like us to go ahead and wrap up with any final thoughts from our panelists.
Dr. McDermott,
I'll
close for us, and I'll just say, number one, I want to thank all the members of our community tuning into these town halls and for your level of interest. I know many of you are going out in the community and helping us spread the word. I think that's very, very important. So thanks for taking the time and having the interest to tune in to hear about what's happening here in our community. Again, I want everybody in our community to know how lucky they are that we have the staff that we have here at Mary Washington Healthcare, our entire care team, all of our nurses, respiratory therapists, our environmental services folks, our food service folks, everybody. It is a radiologic technology. It's the team of folks that is required to care for our community. And this team of folks that is showing up every single day here, being overwhelmed with the care demands of our community currently, and everything that they're doing so creatively to make sure everybody gets great care. Our community is very lucky to have the associates that we have here as part of our care team. I want to thank all of those associates for everything that they're doing, rising above one more time, doing everything that they can do for our community at this point in time. They are heroes. There's no doubt about it. And our community, I hope you recognize how lucky you are to have the care team that you have here at Mary Washington Healthcare. What an amazing group of folks.
Thank you, Dr. McDermott. I'm sure all of our panelists agree that we really do have the best team, and we're grateful to them every day. So thank you to all of our panelists for showing our community what's happening, a little peek behind the curtain of what's happening here at Mary Washington Healthcare. And thank you to all of you for tuning into our community town hall. If you are having symptoms or need a test and not sure where to seek care, call your provider for guidance. If you need emergency care, don't hesitate to come to the emergency room. It's the place to go if you need us. As a reminder, the local Department of Health is offering free COVID-19 testing. It's right here on your screen. You can check their website for the dates and times near you. And I know they register 1 day prior to the testing for those locations. And as a reminder, the health department has offering vaccines as well in the Central Park location. They have a vaccine center. If you've missed any of tonight's town hall, you could watch the recording on your Facebook page or on our YouTube channel. Be sure to share the recording with your friends and family and colleagues so they too can be informed of how the pandemic is affecting our community. Thank you. Please stay safe and healthy and have a wonderful evening.
Good night.